This test is called the APT-HI, which is the Auditory Perception Test for the Hearing Impaired, revised. The author is Susan G. Allen. The results of the test produce a profile of a child's auditory perception skills pertaining to speech perception capabilities, including detection, discrimination, identification, and comprehension. It is recommended that the test is given to an individual child every 6 months to monitor progress. The APT-HI is frequently used with children ages 3 and older who have a mild to profound hearing loss. It can also be used with adults who are in auditory rehabilitation. It is not appropriate for children with severe visual deficits. The administration time for the APT-HI is 20 to 30 minutes. Before beginning the test, it is imperative to ensure the child's listening device is functioning properly. To do this, the examiner should administer the Ling 5 sound test, which include the sounds oo, ah, e, sh, s, n, and no stimulus. The following subtests are given: auditory awareness, tasks, duration, intensity, and pitch identification tasks, prosodic perception tasks, vowel perception tasks, consonant perception tasks, other segmental perception tasks, linguistic perception tasks, and communicative comprehension tasks. Each of these subtests have a visual auditory and an auditory-only component, except for the final subtest. This subtest, the communicative comprehension task, is auditory only.
The first subtest is the auditory awareness tasks. There are 2 components to the subtest, which include the speech and non-speech tasks. The non-speech tasks require the child to respond immediately following the presentation of a non-speech sound, such as clapping. The speech tasks involve the child's verbally matching a linguistic presentation, which will indicate their level of ability to identify and produce the sounds. The student identifies the number of repetitions of a speech sound. The speech sound used is ba. The student must respond by orally repeating or pointing to pictures representing the number of sounds given. This is the non-speech sounds. This is the speech sounds. Ba, ba, ba.
Subtest 2, Duration, Intensity, and Pitch Tasks. The first section is duration. The student identifies a speech sound as being long or short in duration. The short vocalization is about 1 second, and the long vocalization is about 3 seconds. The student must orally repeat the vocalization or point to the picture with which it corresponds. The second task of the duration of 2 speech sounds with varied speech sounds of equal or varying length. The third task is the identification of 3 speech sounds with equal or varying length. Our example will show task 1 of duration. Ba,
Ba,
ba.
ba.
The second section of subtest 2 is intensity tasks. The first task includes identification of intensity of a single speech sound. Loud sounds are produced at a level just below shouting, and softer sounds are produced at the level of normal conversation. The second task includes 2 speech sounds with 2 varied levels of loudness. The third task includes 3 sounds with 2 levels of intensity. Our example will show task 1. Ba, ba. The third section of subtest 2 is pitch identification. The first task involves identification of a single pitch sound, high, or low. The second task is the identification of two speech sounds with varied sounds of equal or unequal patterns of pitch. Our example will show task 1. Ba, ba.
The third subtest is prosodic perception. The client identifies words using suprasegmental information such as syllables, duration, intensity, or pitch to distinguish between two words. One word has one syllable and the other word has 3 syllables. In the second task, the child must identify between words and syllables, one word being 2 syllables in length and the other word being 3 syllables in length. The third task requires the child to discriminate between sentences. One sentence has 2 syllables and the other sentence has 4 syllables. The fourth task requires the child to discriminate between one sentence that has 3 syllables and one sentence that has 4 syllables. Our example will show task 1. Hamburger,
Hamburger,
dog,
dog. The next task is the vowel perception tasks. This subtest requires the student to identify a specific vowel every time it occurs in a set of other vowels or diphthongs presented in isolation. The student must orally repeat the vowel and point to its representation on the plate book every time it is said by the clinician. Task 1, 2, and 3 occur in isolation. These vowels include oo, ah, and e. Task 4, 5, and 6 are identification of words containing differing vowels or diphthongs. The diphthongs used in Task 4 are oi, e, and o. Those used in 5 are o, a, and oo. And those used in 6 are I, oo, and ah. Our example shows Task 1, vowel. The target is ah, ah,
Ah.
oo, e, ah.
Ah. The fifth subtest is the consonant perception tasks. This requires the student to identify specific consonants based on place, manner, or voicing in the beginning of words. The examinee must point to target consonant and point to its representation on the plate book. There are 3 tasks for manner, which include 3 different consonants each. The first set are m, t, r. The second set is m, t, sh. And the third set is b, h. The voicing the child identifies different voicing at the beginning of the word. The sounds include p and b, k and g, and then last s and z. The last 2 sections involve identifying words that differ in place. The sounds included here are b and g, and then and Our example shows task 1.
nose,
Nose,
toes,
toes,
rose,
rose,
nose,
nose,
rose.
rose. Subtest 6. Other segmental tasks. This subtest includes multiple components in which the child must identify different phonemic and segmental information in words and phrases, such as blends or minimal differences. Sections 1 through 3 are words ending in different phonemes or blends, such as s as in cats, nz as in cans, as in time, I as in tie, g as in pig, gz as in pigs. Sections 4 and 5 are different phonemic environments, such as as in home or mother, ch as in chew or kitchen. Sections 6 through 8 are segmental perception tasks with either a maximal difference, such as the blue car and the red box, or a minimal difference, such as the red box and the red fox. Our example is Task 1, Different Blends. Cats,
Cats.
cans,
Cans.
cans,
Cans.
cats.
Cats. Subtest 7 is Linguistic Perception Task. The student repeats verbatim sentences that represent a picture. There are 6 tasks in this section. Tasks 1 through 3 are sentences describing the first picture. Tasks 4 through 6 are sentences describing the second picture. Our example will show tasks 1 through 3. The girl is riding on a horse.
The girl is riding on a horse.
The boy is chasing a brown dog.
The boy is chasing a brown dog.
The brown dog is chasing a cat.
The brown dog is chasing a cat. Task 8 is communicative comprehension tasks. In this auditory-only subtest, the examinee answers familiar questions without a stimulus picture. There are 6 tasks in this subtest. It is important to remember that this subtest is auditory only. The examiner can alter the questions to better suit the age of the student. Our example shows tasks 1 through 6. Do you like ice cream?
Yes.
Do you like hot dogs or hamburgers?
Hamburgers.
What is your mother's name?
Joy.
What do you eat for lunch?
Sandwich.
What is your favorite fruit?
Strawberry.
How old are you?
22.
Now we will discuss the scoring of our tests. The first 6 sections, including auditory awareness, duration, pitch, and intensity, prosodic perception, vowel perception, consonant perception, and other segmental perception, are scored using the following criteria. 5 correct responses equals developed. 4 correct responses equals emerging. 0 to 3 correct responses equals missing. The linguistic perception section is scored using the following criteria. 7 correct words equals developed. 4 to 6 correct words equals emerging. 0 to 3 correct words equals missing. The communicative comprehension section is scored using the following criteria. Correct semantic response to question equals developed. No response or inappropriate response equals missing.
Inside the test book, you can record the student's information, their listening device, scoring information, and then you have the subtests, which is where you mark the correct responses of the student and then add them up after each subtest to see how many they got correct. Here you have the auditory awareness, the duration, intensity, and pitch identification tasks, which continue on to the next page, and see the symbols here. They correspond with the pictures in the plate book as whether it is soft or loud, and how many sounds you are doing per task. Then you have the prosodic identification tasks, vowel perception tasks, consonant perception tasks, Other segmental perception tasks, which continue on down the entire next page. The linguistic perception tasks, and the communicative comprehension tasks, where you write down the student's response verbatim. In the back of the scoring manual, you have the sections for each subtest, which is divided by task, and you shade in each section depending on how many scores the child got correct, as whether they are classified as developed, it'll be fully shaded, emerging, half shaded, and if it's missing, you leave the task section completely blank.
This is a criterion reference test, meaning it is not standardized and there are no specific norms or raw scores to be compared. The profile will show strengths and weaknesses and performance by category and will aid in differential programming based on the child's auditory development. The differences between the auditory only and auditory visual components will assist in transitioning a child from visual dependence to dependence on hearing.
When administering the APT-HI, the examiner should have a screen available to hide the mouth and face to ensure that the child cannot read facial cues such as eyebrow raising or speech reading. The APT-HI includes the following materials: an instruction manual describing the test's purpose, development, administration, and scoring procedures, with appendices that provide additional activities for auditory perception and listening training. It also comes with a plate book containing pictures and task items with explanations of the procedures for each task, and a record form for marking tasks as developed, emerging, or missing, with profile forms for summarizing auditory, visual, and auditory-only performance, and a presentation and assessment demonstrations that provide examples of testing techniques and training strategies.
Initial test results can be used to determine present baseline levels of auditory functioning, identify specific strengths and weaknesses, and develop auditory and speech targets for training. Results from subsequent administrations of the test can be used to document developmental progress achieved by children participating in an ongoing auditory learning program. The APT-HI auditory skill performance profiles serve to determine appropriate objectives, strategies, and learning activities for developmental listening training or remedial management programs by identifying specific auditory tasks necessary to improve a child's use of audition and ability to connect meaning to sound. Identification of specific auditory tasks for inclusion in an auditory learning program begins by examining the tasks on which a child scored at the emerging level. Typically, an individualized auditory development program starts with sequencing these tasks as the first set of target skills to be developed. Activities to be used in developing the targeted skills then can be generated. After the original set of target skills has been developed, skills on which the child scored at the missing level should be sequenced, and appropriate activities for developing these skills should be generated and incorporated into the child's listening or training program. Remember to cycle targeted skills as you would cycle phonemes in a speech articulation program. The test results and the tasks identified for use in an auditory development program may also serve to identify specific targets for speech therapy.
In conclusion, auditory learning is critical to acquiring intelligible speech.
With early and effective intervention, children with hearing impairments can reach new heights in communicative competence.
The development of optimal listening skills is the foundation of other critical skills.
The APT-HI is intended to be a tool to best serve the needs of children with hearing loss and the hearing loss professionals. This video presentation has been brought to you by Group Dose. Olé!